Non-Hodgkin lymphoma (NHL) in children is a type of cancer that originates in the lymphatic system, which is part of the immune system. NHL is one of the most common cancers in children, accounting for about 5% of pediatric cancers. Here's a detailed overview. 1. What is non-Hodgkin lymphoma? NHL is a group of cancers that arise from lymphocytes, which are a type of white blood cell. Unlike Hodgkin lymphoma, NHL does not contain the Reed-Sternberg cells that are characteristic of Hodgkin lymphoma. NHL can occur at any age, but it behaves and is treated differently in children compared to adults. 2. Types of non-Hodgkin lymphoma in children. The most common types of NHL in children include lymphoblastic lymphoma, often associated with T cells and resembles acute lymphoblastic leukemia. This type typically affects the chest and may spread to bone marrow or the central nervous system. Burkitt lymphoma, a fast-growing cancer associated with B cells, common in children. It often affects the abdomen, jaw, or facial bones. Diffuse large B-cell lymphoma, the LBCL. This type involves mature B cells and is the most common form of aggressive lymphoma. Anaplastic large cell lymphoma, ALCL, involves T cells and often affects the lymph nodes, skin, lungs, and bones. 3. Symptoms of NHL in children. The symptoms can vary depending on the location of the cancer but may include swollen lymph nodes, often in the neck, underarm, or groin, without pain. Abdominal pain or swelling, if the lymphoma is located in the abdomen. Chest symptoms, cough, shortness of breath, or chest pain, often due to enlarged lymph nodes in the chest. Fever, often without an obvious infection. Unexplained weight loss. Night sweats. 4. Diagnosis typically involves physical exam, checking for swollen lymph nodes, spleen, or liver. Imaging tests, such as X-rays, CT scans, MRI, or PET scans to identify tumor location and size. Biopsy. A lymph node biopsy or bone marrow biopsy is done to confirm the presence of cancer cells and determine the type of lymphoma. Blood tests, to evaluate the overall health of the child and determine if the cancer has affected other parts of the body. Lumbar puncture, to check for spread to the central nervous system. 5. Treatment of NHL in children. Treatment of pediatric NHL is intensive and tailored to the specific type of lymphoma and the stage of the disease. The main treatment options include chemotherapy. This is the primary treatment and involves using a combination of drugs to kill cancer cells. Children with NHL usually receive higher doses than adults. Radiation therapy, less commonly used but may be an option for certain types or stages of NHL. Stem cell transplant, used in cases where the disease relapses or doesn't respond to chemotherapy. High-dose chemotherapy is followed by a transplant of stem cells. Targeted therapy, in some cases, drugs like rituximab, which targets B cells, may be used alongside chemotherapy. 6. Prognosis. The prognosis for children with NHL is generally favorable. Most children can be cured, especially if the disease is diagnosed early and responds well to treatment. The 5-year survival rates for pediatric NHL are around 80 to 90% for localized disease, 60 to 80% for more advanced stages. Children may experience long-term side effects from treatment, but overall, the outcomes have improved significantly in recent decades. 7. Long-term follow-up after treatment. Children need regular follow-up to monitor for recurrence and manage any side effects of treatment. These may include growth and developmental issues, organ damage e.g., heart, lungs from chemotherapy or radiation, secondary cancers later in life. 8. Risk factors. There are no clear causes of NHL in children, but certain factors may increase the risk. Weakened immune system. children with immunodeficiency conditions e.g., HIV or those taking immunosuppressive drugs after an organ transplant. Genetic conditions, conditions such as Wiskott-Aldrich syndrome, ataxia-telangiectasia, or congenital immunodeficiencies. Infections, certain viral infections, such as Epstein-Barr virus EBV are associated with Burkitt lymphoma. 9. Support for families. Families dealing with pediatric NHL often require emotional and psychological support. Treatment can be intensive and lengthy, affecting the entire family. Pediatric oncology centers usually provide counseling, support groups, and resources for coping with the challenges of the diagnosis and treatment process. Conclusion: Non-Hodgkin lymphoma in children is a treatable and often curable condition, though it requires prompt and aggressive treatment. With advances in therapy, most children with NHL can expect a good outcome, though long-term follow-up is crucial to address any late effects of treatment.